Hi, this is Autumn recording for Mark. There's the room. Okay, go ahead.
Okay, hi, my name is Mark. I'm a nursing student at Marine Bailey. I was here to do a physical assessment on you today. Is that okay? All right, thank you. Could you confirm for me, please, your name and your date of birth? Confirm name and date of birth. The client looks appropriate for age for his record. I'm looking at the patient. They seem to be smiling. There are no signs of distress at all. The patient's relaxed in the bed and is calm. And thank you for confirming your name and your date of birth. Can you tell me what month we're in? Can you tell me where you're at today? And can you tell me why you're here? Patient's A&O ×4, and the patient I'm checking is for grooming and hygiene. Hygiene seems to have been showered in the last few hours here. Grooming, his hair is combed. Thanks for all that. That looks good. Got a full set of vitals on the patient. Everything was within normal ranges. Next, I'm going to inspect his head. So the head appears to be round, proper shape, no issues there. His face, can you lift your eyebrows and can you smile for me? Face is symmetrical, looks good. Next, can you, just looking at his face here, this skin seems to be proper color, and his lips appear to be proper color, no issues with texture or anything like that. Looks good. Now I'm going to take a look at his neck. It seems to be symmetrical. His substernal notch and his tracheal midline. I'm going to check his hair in 3 spots on parting, and the hair seems to be evenly distributed and healthy. There's no psoriasis or lesions on his scalp. All that appears to be healthy. His shoulders seem to be even, and that all looks good. Perfect. Next, I'm going to palpate his head, and I don't feel any masses or tenderness. He reports no pain. I'm going to next palpate his carotid artery. I'm feeling on each side for rate, rhythm, and force, regular rate, rhythm, and a force of 2. That looks good. Now I'm going to his head, here, palpate for his lymph nodes. So I'm going to check for the preauricular, postauricular, occipital lymph nodes. Feel for the tonsillar, submandibular, and then submantellis, and then move on to the anterior cervical, posterior cervical, and the supraclavicular lymph nodes. I don't feel any masses. You report no pain. There's no tenderness there. So that all looks good. So that's good for palpating my 3 spots. Next, I'm going to move on to target assessment for, also, sorry, I forgot to mention, with A&O ×4, the patient was able to respond to all my questions, so his basic speech seems normal. So that's good. Next, I'm going to do each part of the face. So we're first going to check his eyes, the eyebrows, hair distribution, and the eyelashes hair distribution seems normal. Checking the conjunctiva and the sclera. As I pull down his eyelids, conjunctiva is pink and moist, sclera is clear and white. There's no significant lacrimal drainage or issues there. And next I'm going to check the eyes for perla. So the eyeballs, so the pupils seem to be equal, round, reactive to light. Now I'm going to check for accommodation. Steerly follow the tip of my pen light as I bring it to your nose. And his eyes are accommodating. So the eyes all look good. No issues I can tell there. Next thing, do extraocular movements. So, sir, would you keep your head still? Would you follow the tip of my pen light as I bring it in a star pattern here? Okay. No deficits with the extraocular muscles. So eyes are all set. Next, I'm going to just go to the ears. I'm checking both ears for drainage. I don't see any drainage. Identifying the auricle on either side, identifying the lobule on both sides, pressing on the tragus, asking if there's any pain there. No reported pain. The ears don't have any like lesions, cracks, anything like that. The skin's intact and healthy looking. Based on my conversation with the patient so far, he's been responding to my questions. So basic hearing seems to be okay from that, but I'm gonna do a different test, the whisper test. I'm gonna stand here out of the patient's view, have him include his opposite ear. I'm gonna say 3 words and ask for him to respond. Tic-tac-toe. And then I would, of course, would do that on the other side as well. He passed the whisper test, so his hearing seems to be okay. And that's good. So I'm done with the ears right now. Next I'm gonna go on to the nose. So I'm checking the nose for the mucosa. Mucosa seems pink and healthy. I don't see any obstructions in the nose. I'm gonna check for patency and I close each nostril, have a breathe in and out on both sides. Able to breathe in and out. And there's no subtle deviation that I can tell. There's no flaring of the nostrils. So that seems good for the nose. Next I'm gonna move on to the mouth. I'm checking the mouth here for the buccal. Can you lift your tongue for me, sir? Sublingual mucosa, both seem good. Checking the hard and soft palate. Checking the tonsils, they don't seem swollen or red or anything like that. Uvula is midline, and as it breathes in and out, it moves. I'm checking the teeth for decay, loose teeth, dentures, none of those issues, all the teeth are intact. So the mouth all looks good. Next I'm going to check for eyes, ears, nose, mouth, teeth. Oh, and the gums are also healthy. Then I'm going to start looking at the patient for the breathing. The patient appears to be a nose breather. The patient doesn't seem to be using any accessory muscles to breathe. Can breathe evenly, supine, prone, and also sitting upright. So breathing seems good. I don't know if I said this, but neck is also even, symmetrical. Substernal arch and the trachea are both midline. Shoulders are even. So all those things are good. So back to the breathing. I've mentioned those parts for the breathing. Next I'm going to auscultate the I'm going to inspect the chest next. So I'm going to inspect the chest. It seems to be even and symmetrical. I don't see any obvious issues with the chest at all. It seems symmetrical. There's no like odd contour or anything like that. So that seems good. Let's see, I know about the chest. All right, so I've inspected the chest. Now I'm going to palpate the chest. Palpating the chest here. I'm feeling for masses, crepitus, tenderness. I don't feel any of that. I can't remember if I did the head or not. So I'd also check the head for masses, tenderness, crepitus. Doesn't report any of those things. I believe I already did the lymph nodes. Perfect. Now, for the abdomen, it looks symmetrical, even. So I inspected it, I palpated it, now I'm gonna auscultate. Oh, I just palpated it generally, but I have to palpate at the heart, the cardiac landmarks as well. So I'm going to start off in the second intercostal space on the right side of the sternal border. I'm going to feel for the apical cardiac landmark, or for the aortic cardiac landmark. Second intercostal space on the right sternal, on the left sternal border for the pulmonic cardiac landmark. Third intercostal space for the Erb's point along that left sternal border, and the fourth intercostal space on the left sternal border for the tricuspid valve, and then the fifth intercostal space midclavicular for the mitral valve. This is also where the point of maximum impulse is for the heart, the apex of the heart. Alright, so I've palpated the chest now. Now I'm going to auscultate the chest. So I'm going to listen again for the lung sides and all sounds in all 5 lobes. I'm going to do the ladder pattern: 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8. Of course, when I palpate and I auscultate, I'm going to listen laterally and posteriorly as well. So I've listened, I'm auscultated now for the lung sounds. They were, there's no adventitious lung sounds at all. They were clear. There was no pops, cracks, weasels, pops, cracks, anything of that nature. Wheezing, whatever. Now I'm going to auscultate the same cardiac landmarks that I previously mentioned. Abdomen, 1, 2, 3, 4, 5. When I auscultated for the cardiac landmarks as well, there was no lifts or heaves. The heart sounds all sounded normal to me. Next, I'm going to auscultate the chest. I'm going to move on to the abdomen. The abdomen is free of scarring, petechiae, striae, pulsations, masses, just from the visual inspection. So I've inspected the abdomen. Next, I'm going to auscultate the abdomen, and I'm going to auscultate the abdomen starting in the right lower quadrant, upper right quadrant, upper left quadrant, lower left quadrant. I listen for a full minute for bowel sounds. Normal range is 5 to 30 per minute. I heard 7 in each, so it's like hyper or hypoactive bowel sounds. They all sounded correct, or normal, I should say. Next, after I've auscultated the abdomen, I'm going to palpate the abdomen in the same clockwise fashion, starting in the right lower quadrant, moving up to the upper right quadrant, upper left quadrant, left lower quadrant. I'm feeling for masses, crepus, tenderness, pain. I feel one of those things, the airport's no pain. After the abdomen, I'm going to check the genitals. And for the genitals, I'm checking to make sure that also for the visual inspection of the chest, if I didn't mention, the color of the chest was good. For the genitals, I'm checking for the color of them, the overall skin integrity and health, seems healthy. There's no drainage, no lesions. The stool was brown, formed, and soft. It's like a type 4 on the Bristol chart. The urine was clear and yet pale yellow, so that is normal as well. There's no drainage from the genitals. Next, I'm going to check the extremities. So I'm checking for temperature here. It seems warm, dry, and even. On the extremities, the back of my hands, checking for the joints. There's no asymmetry, no swelling. All that seems good. I'm going to check for capillary refill on the fingers and toes. The fingers I'm going to pinch for 5 seconds, release, make sure capillary refill happens within 2 seconds, and check that for each of the 10 digits on the toes and the fingers. It's good. I'm going to check for pulse points. So I did the carotid artery. Now I'm going to do the pulse points, radial pulse. I'm going to do the femoral pulses. I'm grading these for rate, rhythm, and force. Regular rate, regular rhythm, force of +2. Popliteal pulses, the pedal pulses, and the anterior tibial pulses. All rate, rhythm, and force are good. +2 score for all those as well. Then, let's see. Normally I keep the mannequin, the patient covered. For the purpose of this video, I just have them exposed. Next, I'm going to check for a thoracic expansion. So I'm going to have the patient breathe in and out. I do this on the front and the back, but I'm just holding my hands, making sure that when the expansion comes, that the chest is moving evenly, appropriate depth. Looks good. Perfect. Genitals. I'm going to start checking for strength. So I'm going to have the patient grip my hands as strong as you can, push against me, pull against me. The strength seems good and symmetrical. I'm going to have him do gas pedal with his feet, push against my hands, perfect. Pull back against my hands, bring your toes to your nose. That seems good as well. I forgot earlier to do the active range of motion on the neck. So I'm going to ask the patient to follow after me with the range of motion. I'm going to ask the patient to bring his neck down, that's reflection, bring his head back to normal position. That is extension, and look up at the ceiling, that's hyperextension. Ask them to turn their head to the right, turn their head to the left, and then tilt their head to the right, tilt their head to the left. You can demonstrate all that. Next, I would ask him to move his head to turn it to the right against force, turn it to the left against force. I'd ask him to bring his ear to his shoulder against force, bring his left ear to his left shoulder against force. Force seems symmetrical and good. Active range of motion in the neck is good, with and without resistance. So now I've had him do the strength with the feet, the legs, everything. I'm going to ask him to do the active range of motions. So I do this on the upper extremities first. Can you supinate? Can you pronate? Can you flex? Can you extend? Can you abduct? Can you adduct? Can you circumduct? I'd have him repeat that on the legs as well. That looks good. All right. think I skipped ahead earlier, but I'm checking again the joints for the symmetry, no swelling, arthritis, anything like that. Next, I'm going to do overall skin check. I'm doing this on the front of the patient, obviously, but I'd also do it laterally and posteriorly. Checking to make sure that the skin is all intact, that it's even, there's no blotching or other issues with the skin. Skin looks good. I'll do the active range of motion exercises. Next, I'm going to ask the patient to stand for me, checking his posture first, and then I'm going to also check his gait for spasticity, for tics, for tremors, for tremors, tics, tremors, for evenness and for symmetry. Now I'm going to do the Romberg test. The Romberg test, I'm going to have him stand. He's going to remain standing with his eyes open for 30 seconds to show balance is even, then close eyes for 30 seconds, be able to maintain his balance. He's able to maintain his balance in both positions, then he passes the Romberg test, so that's good. Patient does not use any assistive devices. And after that is when I have him do the range of motion exercises, which we already completed. Alright, so range of motion exercises are completed. That concludes my physical exam. I'm going to put the patient's bed back into the lowest position for safety. Hand him the collate. Sir, I'll be back in 30 minutes to check on you. Please hit your collate before then. Before I leave the room, is there anything I can get for you? No? Perfect. All right, well, again, feel free to hit that collate. Thanks for letting me do my physical assessment on you. And I'll be back soon to check on you. Wash your hands.